So most of the people that come to see me for a facelift consult are people who are still very active. A lot of times they're still working. They feel really good. They feel young on the inside, and they really feel that their outsides don't match their inside. So they're coming to see me about rejuvenation options. The age range of patients ranges really anywhere from your late 30s all the way up into people in their early 80s. A lot of it depends on genetics, whether they've had a significant amount of weight loss or weight gain, and how well they've really taken care of their skin. So the type of facelifts that I do in my office most commonly is what I call a deep plane facelift. In the deep plane facelift, you address the underlying structures, such as the SMAS, which is the fascial layer that all of the muscles and fat pads and underlying tissues are attached to. By addressing this layer, it allows you to pull the internal portions really tight, almost like an internal corset. Then I'm able to loosely drape the skin over, and it prevents you from getting that windblown look. It also increases the longevity of the surgical results. Additional benefits of the deep plane facelift is they give very natural appearing results. Patients look rejuvenated, they look rested, they don't have that tight pulled windblown surprise look that a lot of people have negative associations with when they think about facelifts. That's why I really prefer using this method. One of the most common questions I get about facelifts is how much downtime. I tell all of my patients to expect 2 weeks of downtime and to request 2 weeks off from work. After 2 weeks, patients are ready to go back to work, but I expect them to still take it easy. After 4 weeks, patients are released to full cardio, and after 6 weeks, back to lifting weights or any heavy physical labor. I tell all of my patients to consider a deep plane facelift as restarting the clock. Genetics and standard aging processes are still occurring, so it's very important after surgery to protect your investment with good skincare and a healthy lifestyle. A lot of times, 10 to 15 years later, patients may consider doing a tuck-up or revision facelift if they're concerned about any issues. One of the unique things that I offer is post-operative home visits for all of my facelift patients. It's very important to me that the post-operative process is as stress-free and relaxing as possible for all of my post-surgical patients. The first few visits I do at the patient's home.